That nodding syndrome does not exist in Uganda alone. There is nodding syndrome in South Sudan, there is nodding syndrome in Tanzania, and in other countries. Nodding syndrome has been associated to onchocerciasis or the black fly, the similium flies. And during research, it was found very clearly that it is an autoimmune reaction to the worm that gets into the body. The body produces antibodies against it. Antibodies are armies that go to fight the worm. But the protein that they attack on the worm is also in the brain. So the antibodies also turn and attack the same protein. And that is why we end up with nodding syndrome. But onchocerciasis itself also causes river blindness. And that is why the patients also get blind. Now, the unfortunate thing is that it is a neurological disorder. And when you continue having seizures, eventually you get brain damage. It is not easy to reverse the brain damage, but we can improve on the quality of their lives. Improving on the quality of their lives is a multi-sectoral approach. It is not the issue of the health sector alone. The people who have to be in the front line are the parents. You have to love your child. And I want to repeat this, there are no new cases. Research has shown there are no new cases. Why are there no new cases? Because the communities have embraced ivermectin. Ivermectin reduces on the filaria that is in the body, the worm that is in the body that causes the damage. And what researchers are doing now, they are looking for a way of killing the adult worm. Because once the adult worm is in the body, it doesn't die. It lives for over 5 years. It continues to produce the filaria. If you don't swallow the ivermectin, the filaria will be in your body and eventually you will get nodding syndrome if you are a child. But if you swallow the ivermectin, which government is giving on a biannual basis every 6 months, then you will get rid of the filaria. And once we find a drug that gets rid of the adult worm, we will be able to get rid of nodding syndrome. But as it is now, that research is going on.